Hello, I'm Gary Rogers and I'm the Program Lead for Interprofessional Learning at Griffith Health. Congratulations on starting a program of study that puts you on a path to becoming a health or social service professional. You know, into the 21st century, health and community service graduates will increasingly do most of their work as members of teams, where practitioners from different professions will need to collaborate effectively to improve the health and well-being of the patients, clients and communities they serve. The purpose of these introductory learning activities is to help you to achieve what we've called health professions literacy. By health professions literacy, we mean an understanding of the history, theoretical underpinnings, philosophy, roles and contributions of each of the major health and community service professions, including the one that you're heading for yourself. In order to help you to gain this understanding, we'll follow the story of a man called Dave and his interactions with health and community services. Once you know something about all of the major professions, you'll be well prepared to learn alongside colleagues from other health schools so that you can acquire the skills and capabilities that you'll also need to be an effective member of interprofessional teams in your future practice. This is Dave Andrews. He's 49 years old and works as a self-employed civil engineer, mostly in the mining industry. He's currently on his way to work on a project in central Queensland. Dave works as an independent contractor and these days runs his business from his apartment on the Gold Coast when he's not away on a job. He doesn't feel he can justify the cost of an office and administrative help, as things are pretty tight financially at the moment. He usually finds his jobs through his extensive network of mates in the construction and mining industries.
Look, I can certainly help you out. I've just got a job up in Mackay, first of all. I've been asked to help out on a construction mining camp up there in far north Queensland. Look, it doesn't start for about 4 months. I might be able to fit your job in between.
Dave has never taken out health insurance or income protection because he's always seen himself as young and healthy. He used to play rugby league and played a few A-grade games in his 20s. He doesn't get much exercise these days, but he still thinks he's pretty fit. Dave lives by himself. He was married for 25 years, but about 2 years ago the long-standing problems in his relationship with his wife Frida came to a head.
Dave, I don't think I can take this any longer. I mean, you're always away at work, and then when you are home, you drink beer in your chair until you fall asleep. What kind of life is that for us? I love you. I want to be with you, but I'm tired of having this argument.
Sweetheart, you know I'm trying to do the right thing by you and the kids. I mean, you of all people should know how tough it is in this industry at the moment. What, with the mortgage on this place and Simon's school fees, I just can't afford to turn down any work.
Then, one day, while he was away on a job, Dave received an unexpected letter. Dave and Frida have 2 children. The eldest is Sass, aged 24. She's recently graduated as a dentist and lives in Melbourne with her husband Sam. She's currently pregnant with their first child. Dave and Frida's son Simon is 16. He goes to a prestigious private school on the Gold Coast and wants to study to be an engineer like his dad.
I guess we're going to have to finish up now, Dad. Mum wants me home by 6 to get ready to go out for dinner.
Alright, mate. I'm stuffed anyway. Come on.
Dave now only sees Simon for short visits when he's on the Gold Coast. They always seem to be over far too soon. Dave has smoked since he was 17. He quit successfully for a couple of years, but started up again around the time of the divorce. He now smokes about 30 cigarettes a day when he's at home, but more like 50 a day when he's away for work. He drinks about 3 stubbies of full-strength beer most evenings when he's at home, usually while he's doing paperwork for the business. That increases to more like 5 stubbies a night when he's working away. About once a month, Dave will have a night out with his mates. On these occasions, he'll drink up to 10 stubbies of beer and sometimes drives home afterwards. Dave hasn't ever used any kind of illicit drugs. That's never been his cup of tea. About 2 years ago, Dave made a rare visit to a GP's surgery near his home.
You see, Doc, I'm heading off to Broome next week for work, and this cough's just driving me crazy. I was wondering if I could get some antibiotics.
Well, look, you've got some wheezes in your chest, but from what you've told me, it's much more likely to be a virus infection. Antibiotics aren't going to make any sort of difference. And your smoking, of course, doesn't help.
Yeah.
What I'd recommend is inhaling some steam a couple of times a day, just a hot steamy shower, and then afterwards have a good cough.
While Dave was there, the GP took the opportunity to take his blood pressure, which was significantly elevated. She also convinced him to have a cholesterol test, which showed that he had an unfavourable lipid profile and raised liver enzymes associated with alcohol use. The GP telephoned Dave with those results, but he was already in Broome. He said that he'd make an appointment to follow up, but got busy at work and never got around to it. So Dave's life has had its ups and downs, and he feels like he has a lot on his plate. But today, things are going to get a lot worse. Like many men, he's tried to avoid thinking about his health or interacting with the health and social service professions. But he's about to have no choice.
Hello David, can you open your eyes up for me? Hello, it's Helen from the ambulance service. Do you know where you are? Are you able to squeeze my fingers for me? That's it. Yeah, darling, you've got a really big laceration on your right hand there. Okay, I have bandaged it up. All right, what about your feet down here? Can you push down on your feet? Can you feel me pinching this foot here? You've got a broken leg on that side, doll. I know. I'll get you some pain relief shortly. Hi, my name's Helen Zahos. I'm a paramedic. Paramedics are responsible for caring for critically unwell people out in the community and attending scenes of accidents or just people that are generally unwell and require transport to hospital. The history of the ambulance service in Queensland dates back to 1892 when a gentleman by the name of Seymour Warrion, who was an army medic, happened to be at the Brisbane Showgrounds and he witnessed an injury. And he also witnessed people just walking that injured person off the field, and he realised that in the army setting things worked a little bit differently, and perhaps we could bring that military way of looking after people pre-hospital to the forefront here in Queensland. Well, now's a really exciting time for the paramedic profession because we're moving away from on-the-job training into a more tertiary style of education. This means that students are able to learn their clinical skills in the university and apply theories behind why they're doing these certain skills. They can then apply that out in the practical setting when they're out on prac, working with mentors out in the field, and eventually when they come out they'll be proficient clinicians. The paramedic profession nowadays doesn't mean that the paramedic goes out and retrieves a patient and delivers them to the hospital. They actually follow clinical practice guidelines that are based on extensive research that have been done repetitively over the years to improve patient outcomes. So patients get the best care and the appropriate care, and paramedics know that they're diagnosing appropriately, applying the correct treatment, and it's for the best possible patient outcome. Can you tell me where you are? That's right, you're in an ambulance. We're taking you to hospital now.
Dave has now been in hospital for 3 days. He has a number of injuries. He suffered a significant closed head injury and was quite confused for several hours. He also fractured the tibia and fibula bones in his left ankle. This required orthopedic surgery with a plate and screws. Perhaps the most serious injury, though, was to Dave's right forearm. The side window of the car was broken in the accident, and the glass caused a deep cut on the front of his forearm. One of the 2 major nerves to his hand, the ulnar nerve, was partially cut, and several tendons were also injured. The structures were repaired by a plastic surgeon using microsurgical techniques, but there's still a significant risk that he'll be left with serious disability in the hand, and very careful follow-up treatment will be required.
Hi, Mr. Andrews. I'm Sean. I'm going to be your nurse today.
G'day, Sean. Just call me Dave.
Yeah, no problem. Listen, I'm going to be taking your observations. Have you had them taken before?
Oh, in the past. Yeah.
Oh, good. I'm going to be taking your temperature and your blood pressure, pulse. I'm also going to check your oxygen in your blood with this sensor. Hi, my name's Sean Burgoyne, and I'm a registered nurse. Our profession practices safe, practical, patient-centered, holistic care. Nursing has a long history, a great tradition. It originally started with nuns in the Christian church. They provided care for people that didn't have family to provide for them. Nuns provided a safe place for patients to come in the convents. They provided care there, more by trial and error, and passed on traditions, no real formal teaching. So the nuns were actually the first organization that were similar to a hospital and provided patient-centered care. The Protestant reforms in England closed these convents, and basically that whole hospital convents that were run ceased to exist. It wasn't until later that a lady called Florence Nightingale restarted what we have as modern-day nursing. The unique thing about nursing and how we approach patients is we really focus on the patient as a whole, not just, you know, a broken leg or a head injury or a heart condition or acute illness. And we try to treat them with respect, how we'd want to be treated, how we'd want to be cared for. And this gives us a really unique in with the patient. They open up to us. I think it improves our ability to help them. Yeah, just a bit of a slight temperature, but other than that, all your observations are fine. I'm just wondering if you're having any pain right now.
Hi, Sean. Sorry to interrupt.
That's all right. I was finished pretty much anyways. So, Dave, this is Joni, our physio.
Hi. I'm actually here to get you up and about today. Hi, my name's Joni Ralph Wilkie, and I'm a physiotherapist. Physiotherapy is a health profession that focuses on assessing, treating and diagnosing movement-related disorders. These can be acquired from birth, from an injury, or maybe something to do with ageing. So we work with the client closely and basically target those movement disorders with physical therapy. Physiotherapy elements have been traced back to ancient China, Greece and Rome, and a lot of that was documented in terms of being touch-based therapy, so a lot of massage, some manipulation, some acupuncture even, and often those elements are still found in modern-day physiotherapy. And the patient is the centre of the care, so obviously we work with the patient but also with the rest of the healthcare team to provide that care, and obviously the patient's goals, short-term and long-term goals, are really considered, and they're really basically involved in that therapy and in determining how the therapy occurs and when. The surgeon says that your broken ankle is repaired strongly and that he's happy for you to walk on it today. Would you be happy to have a try?
Yeah, sounds good to me, yeah. Sean, you mentioned pain. I noticed I'm having a bit of pain down in my calf. It's different from my ankle, from the op. It's something I didn't have yesterday.
Would you like me to have a look at it? Is that okay?
Yeah, that's fine.
Is that tender to touch?
A bit.
Yeah, Dave did have a bit of a temperature. Just wondering, maybe it could be a DVT.
Yeah, look, I mean, the tenderness is well away from the operation site and there is a little bit of swelling. It could just be from the surgery, but I do think we should probably get it assessed properly. Not much to worry about, it's just that pain might be caused by a small clot in the back of your leg. So I think we should probably get that looked at.
Yeah, certainly worth looking at it.
Yeah, I have no problem calling the medical team. That's
that'd be great.
And maybe we'll hold off on immobilizing him today.
Yeah, absolutely. And look, I'll just come back a little bit later.
Okay.
All right.
Great. See you, Dave. I'm just gonna go call your doctors, and I'll get back to you about what's up.
Thanks, Sean.
Yeah. Hello, Ward G7, Sean speaking. Yeah, I just wanted to talk to you about the fellow Dave Andrews that we got in with the left tib-fib fracture and the right hand injury.
Oh, yes. How's he going? I think we were going to get him mobilised today.
That's right. Well, Joni, the physio, was up here, and we chatted about Dave. The only thing was he was complaining about some calf pain, and his temperature was up at 38.5. We think it may be a DVT.
Okay, we're actually on ward rounds at the moment, but we should be around to see him in a couple of minutes.
Oh, that's great. We'll see you then.
So there's a 12-hour history of pain in his left calf on a background of recent lower limb surgery to this side. The left gastrocnemius muscles are tender, and this left calf is 4 centimetres bigger than the right. Sean, you mentioned that he had a mild fever too.
Yes, Kelly. It was up from 37 to 38.5.
So what are you thinking about, Catherine?
Well, he's 3 days post-operative, so wound infection is a possibility. Although the tenderness is localised away from the operative site, so even though he's been on prophylaxis, you'd have to think about DVT. I'm Catherine Johnson. I'm one of the medical professionals. In fact, I'm an intern, and what we do as medical doctor is we assess and diagnose and treat patients based on information that we've gained from them and their families. Medicine goes back thousands of years. There's evidence that it was being conducted back in 3000 BCE in Egypt. Imhotep, there was evidence that he was a physician, and there's been carvings and things on the walls of medical instruments and different things like that, and it's progressed through the ages. You see it in Greek history and Roman history and up to modern day. Originally, surgery and medicine were considered separate professions. Surgeons were actually barbers, and it wasn't until the 18th century that there were a pair of brothers, John and William Hunter. William was a university-trained physician and John was a surgeon, and he was then the first surgeon to be medically trained, and it united the surgery and medical fields. Doctors work in a whole range of settings. We're not just based in hospital. There's a lot of people that are out in communities, so you get people like GPs or developmental child health people that are out in the community. In the hospital, we're trained in there's a whole lot of different areas that doctors work in, and there's also a lot of different levels of doctors. I'm an intern, so I'm basically the bottom level. We saw Tian earlier, he was a registrar. Registrars are basically someone who's been accepted to do postgraduate training, and they're training to become a specialist in a particular area. And then you've got people like consultants who have finished their training in that area, and they usually lead the medical team. Tenderness is localised away from the operative site, so even though he's been on prophylaxis, you'd have to think about DVT.
Absolutely. So what investigations would you like to order?
Well, he'd definitely be high risk on the Wells category, so I'd be thinking compression ultrasonography.
That's right. Mr. Andrews, we think we need to organise an ultrasound scan of your left leg to check for a clot in the veins. So that might be explaining the pain and swelling on this side. Have you had any blood clots before?
No. My mother had a clot. She flew to England, London, a few years ago, and they called it what was it called? A trombone.
A thrombosis?
Yes, that's it. Trombone. I seem to be having a bit of trouble finding my words lately.
I meant to tell you about that. I've been on leave, but in the nurse's handover, they had mentioned that he had, David had been having trouble finding his words since he's come back up from the ward.
And did anything like that happen before the accident, Mr. Andrews?
No, nothing like this.
What are your thoughts, Tian?
Well, he had a normal CT scan of his head when he had come in, having said it was a significant closed head injury. So I'll come back and have a look at him and do a neurological exam before I head to theatre and see if we need an MRI scan of his head.
Is there anyone else that you would like to have assessed, Mr. Andrews?
I think it'd be good if he was seen by a speech pathologist, just so we can know the extent of the word difficulties, and he'll probably need quite a lot of therapy to manage the word difficulties.
That's a good idea, Catherine. Could you organise that referral?
Yeah, that's fine.
Mr. Andrews, I think we need to look into the speech problem as well. It's probably related to the bang on your head that you got in the accident, but we need to make sure that nothing else is going on, as well as getting you some help for the problem. So Dr. Klein will come back in a few minutes, and he'll do an exam on you, and then go through everything that we've suggested just now in more detail. Does that sound okay?
Yeah, sounds good. I'd like to get to the bottom of both things.
Okay.
Hello, Mr. Andrews. My name's Tori. I'm the radiographer. I'm going to be doing the scan of your left leg today. We're having a look at the veins in that left leg. I'll have to put some warm gel onto that leg and apply a little bit of pressure. It may be a little bit uncomfortable, but it shouldn't be for too long. Is that okay?
It's fine. Thanks, Tori. Call me Dave, by the way.
Okay, Dave. Alright, let's get started. I'm just going to pop some of that warm gel onto your leg now. All I need you to do is just to keep really still, okay? How's that feeling? Is that okay?
It's fine.
My name's Tori. I'm a diagnostic radiographer. As a diagnostic radiographer, you have many options within either the private or the public healthcare setting. Mainly it's in imaging departments where we take general x-ray, we can perform CT scans, you can specialise in ultrasound, so become a sonographer, or you can also specialise in MRI. So there's a broad range and mix of imaging modalities that you can progress between as your career progresses. Generally when you graduate, you'll start as a diagnostic radiographer doing general x-ray and then specialise into CT, ultrasound, MRI. I think that the most important things that you focus on as a radiographer are patient care, making sure that you look after your patients, you make sure they feel comfortable in the department and make the examination as easy for them as you possibly can. As well as patient care, there's the knowledge behind the radiography that you're performing, so the anatomy, the pathology. If there was one thing that I would want other health professionals to know about radiography, is that it's an ever-evolving technology that we work with, and it's continually updating every day, and there's always a new development, there's always new software or new machines that we get to work with. So constantly gaining new skills, constantly gaining new knowledge, which is a really exciting area to be in.
The compression ultrasonography test showed that Dave did indeed have a deep vein thrombosis, or DVT. This required treatment with medications known as anticoagulants to reduce the clotting ability of his blood, first by injection and then in tablet form. When someone's receiving this treatment, frequent blood tests are necessary to ensure that clotting of the blood is not reduced too much, which would risk excessive bleeding.
My name is Indu and I am a medical scientist. How are you feeling today?
Yeah, not too bad. Just getting pretty annoyed with being in this place, I can tell you.
Yeah, it can get very boring after a while. Look, I'm here to take some blood sample from you because your doctor has asked to check your blood thinners, if they're working all right. Is it all right if I take some blood sample from you?
Getting pretty fed up with being used as a
I
pincushion too, but I guess you've got to do
but
it.
I'll try to be very gentle. We just rest your arm on
Go
this
ahead.
pillow here. And before I take your blood, just want to confirm your IT. You're Mr. David Andrews.
Yes.
And date of birth is 10th of May 1964.
Correct.
All right. I'll just take some blood sample. And before I take the blood sample, I'll just tie this tourniquet and pop up your veins. It won't take very long, and please do let me know if it hurts you. Okay. Just can you make a fist so I can feel your arm? Thank you very much. All right. Just let me know if it hurts you at all. Just cleaning your arms and just going in there. It's all right. You all right? So let me know if it hurts. We're almost done. All right. Just relax your fist. And if you just transfer the blood to your tubes. I'm Indu Singh. I'm a medical scientist. We work in clinical laboratories and private pathologies. We perform lab tests on the blood and the body tissues and body fluids. And most of the tests that we run is help in making diagnosis, as well as monitoring the treatment and the prevention of diseases. In about 300 BC already, Hippocrates started working on blood body fluids. For example, looking at the ants coming on the urine for the diabetes and those kind of simple tests. However, the actual laboratory tests done by the doctors in the corner of their labs actually started in late 1800s. It was not until after World War I, when there was a lot of shortage of the people and the doctors themselves did not have enough time to do all the testing that they used to do in the corners of their offices. So they started training assistants to help them. It was not until 1940s or late 30s that a 3-year degree program started, because by then the laboratories had become real essential part of the hospitals. Even though we are just dealing with the samples and the tissues and just something in a test tube, but end of the day we are working with the patients. We are helping doctors make decisions, and quick thinking, troubleshooting, prioritizing your work, all these things are really important for a medical scientist. The best thing about being medical laboratory science is when you come back next day and you check the patient I was working on yesterday was not going to make it but survived. That's the best thing.
Hello, Mr. Andrews. Sorry to disturb you.
Oh, that's all right. I was just dozing off. How are you?
Good. Look, my name is Libby Cardell. I'm a speech pathologist. I've been asked to see you because I hear that you've been having some difficulty saying some words since the accident.
Yeah, I seem to be going along fine for a while.
Right.
And then I just have trouble finding particular words.
Okay. I'm Libby Cardell and I'm a speech pathologist. Speech pathology is the assessment, diagnosis and treatment of communication and swallowing disorders. In the scheme of things, the speech pathology profession is actually quite new. It's only 60, 70 years old. The first training program for speech pathology in Australia was in 1943. Speech pathologists view communication as a basic human right, and to enable a person to be able to communicate and to interact with the world and to be connected with the world again, be that by verbal means or through some type of augmentative communication, is just an amazing gift to be able to give to someone, but also has a huge impact on that person's quality of life and their entire existence. I think the traditional view of speech pathology is very much the speech, language, communication side of things, but We have a huge role in dealing with adults and children who have feeding and swallowing issues. The best thing about being a speech pathologist is when you have that breakthrough. You might have been working on something for 2 or 3 weeks or sessions, and all of a sudden it clicks. That is so exciting, and the hairs still stand up on my arm when it happens.
Hi, Mr. Andrews?
Yes.
Hi, I'm Fiona. I'm one of the pharmacists here at the hospital. It's my job to talk to you about your medicines. Is now a good time to talk?
Yeah, I guess it's as good a time as any.
Good. I believe you're going home soon and you need to understand how to take your new medicines safely before you go. What have you heard about warfarin, the medicine that you've been started on?
It's a rat poison my granddad used to take.
Yeah, that's right. That's the one. It's an oldie, but it's a goodie. It's one of the best medicines we've got actually for reducing the chance of you having another clot like you've had. I'm Fiona Ellum. I'm a pharmacist. Pharmacists are health professionals who are involved in all aspects of assisting clients with the safe and effective use of their medicines. And we work independently with patients themselves and also with doctors and nurses and other health professionals in multidisciplinary teams. Pharmacists have, I suppose, always been involved primarily with the supply of medicines, but way back in the olden days they also had there was a crossover between the role of the pharmacist and the doctor, so they were very much independent prescribers, and there were pharmacist surgeons and pharmacist dentists and pharmacist vets, and now we've all really found our niche in managing the complexity of healthcare these days by specialising in particular areas. So a lot of that overlap is gone, but the understanding of overall healthcare remains. We start with a really intricate knowledge of drugs and the effect of drugs right down to the cellular level and the chemical level. So we have to start out with a brain that loves science, but we're also a very socially oriented profession as well. So it's this interface between the science of managing disease and treating illness and the human interface of helping people understand how to get the best effect out of their medicines. We have a strong sense of supporting our health professional colleagues, so supporting doctors in making safe decisions about medicines and ensuring that patient care is not compromised, and in supporting nursing staff in how medicines should be administered correctly. And so we're really there as a parallel caregiver, and we work very closely with those other professions to ensure that medicines are used safely. Remember, the dose is going to be 5 milligrams each evening until Wednesday evening, and then on Thursday morning you'll have a blood test, and that'll help decide what dosage to continue on from then. But I've written it all down in the booklet here, so you'll be able to follow that through when you go home. Okay? Have you got any questions for me now?
Is it expensive? Roughly how much?
No, it's not inexpensive, this one. It's probably under $20 for a bottle of 50, and that'll last you a couple of months. And you're not going to be on this one forever anyway. Okay? So I'll leave this booklet with you. You can have a read of that, and I'll pop my head in before you go home if you think of anything else that you want to ask.
Okay, thank you.
But you can always ask your local pharmacist as well when you get home.
Okay, thank you. Sorry, I've forgotten your name.
It's Fiona. See you again.